Good evening. I'm Dr. Kester here once again, and today we'll be discussing the schedule of ultrasound scans in pregnancy. When should ultrasound scans be done in pregnancy? Now, when an expectant mother misses her period, she usually would do a blood or urine pregnancy test to confirm the pregnancy. Now, if the test is positive, it means the pregnancy is about 5 weeks gone, right? Now, after that, she's expected to go to the clinic and register. There, her history will be taken to enable the care providers identify risk factors that may lead to undesirable outcomes. Next, she will be asked to do baseline investigations, one of which is an ultrasound scan. Now, this will be about 5 to 6 weeks gestational age. So now the question is, why do an ultrasound scan at 5 to 6 weeks? One, we want to do an ultrasound scan at 5 to 6 weeks to confirm that the pregnancy is in the uterus, in the womb, to rule out an ectopic pregnancy. Sometimes a pregnancy occurs outside the womb, and this could lead to medical emergencies if there is a ruptured ectopic pregnancy, and we don't want that. So, and ectopic pregnancies usually rupture between 6 to 16 weeks of pregnancy. So it only makes sense for you to scan early so that if this pregnancy is occurring outside the uterus, you can find it before it ruptures. And when it is found early, the obstetricians know what to do to prevent putting the life of this woman at risk. It is life saving. Now, another reason why we do an ultrasound scan at about 5 to 6 weeks is to confirm that the pregnancy is real, that is not a chemical pregnancy. A chemical pregnancy is a very early miscarriage. It usually happens before the pregnancy reaches 5 weeks. So many may not even realize that they have had an early miscarriage if it happens soon after a missed period. So ultrasound scan enables us to know, because how we confirm this is that we are now seeing an actual baby with a heartbeat. Right. We also do an early scan at about 5 to 6 weeks to confirm how many children are there. Are we dealing with a singleton pregnancy or multiple pregnancies? This is important. And sometimes, in fact, in reality, it is easier to know the number of babies in early pregnancy. If this is not done early, sometimes it may be difficult to know. It's easier really in early pregnancy. And it also, if there are twins, it's easier in early pregnancy to know the type of twins you are dealing with. There are different types of twins. There are different types of triplets. And these enable the care providers to stratify the risks associated with a particular pregnancy and prepare for it. We also do an early pregnancy scan about 5 to 6 weeks to appropriately date the pregnancy, to know how far gone the pregnancy is. In the course of pregnancy, as women do different scans, they are given various dates. But the most accurate of these dates, it's usually the date that the ultrasound calculates from the early pregnancy scan, right? It's very good for the woman to know when she saw her last menstrual period is key. But we also need to do an early scan to corroborate the information the woman is giving us. Sometimes some women do not know when they miss their periods. Sometimes for one reason or the other, irregular menses, medical procedures, bleeding per vagina, and all that, the woman may confuse when her LMP is, in which case the obstetrician, the care provider has to rely on good ultrasound dating of that pregnancy. And the best dates, like I said earlier, are obtained in the first trimester scans. Okay? Now, we also do this scan in early pregnancy to check if there are coexisting uterine pathologies. For instance, a coexisting fibroid. Are there fibroids that are there with the pregnancy? How many are they? Where are they located? Is there a cervical fibroid that may be an issue during delivery? So, are there ovarian issues? Are there abdominal issues? So, this is an important reason why an early scan is done. So, the first scan in pregnancy should be done between 5 and 6 weeks. Now, in some countries, the schedule for scanning is different. There is no provision for a 6 week scan. They do their first scan at about 11 weeks. We maintain that the 6 week scan should be performed for the reasons outlined above. If for nothing else, evaluation for ectopic pregnancy. If we have to wait for 11 to 12 weeks to do the first scan, we may miss the first time we may find out about an ectopic pregnancy could be when it has already ruptured. But an early scan at 5 to 6 weeks is advocated, and it's what we do in our center. The next scan should be done between 11 to 13 weeks. This is also called the knockout translucency scan. Now, this scan is carried out from between 11 weeks, 3 days to 13 weeks, 6 days. It is performed through the abdominal routes, that's not transvaginally. It can sometimes be done transvaginally. This is one of the most important scans during pregnancy and is recommended for all women. And I'll tell you why. Now, between 11 weeks to 13 weeks, there is a fluid collection behind the baby's neck. That's what we call the knockout translucency. Now, the measurement of that fluid enables us to assess if this child is at high risk of some abnormalities, of some congenital chromosomal abnormalities, something like Down syndrome, Edwards syndrome, Patau syndrome, irrespective of the name if you're not familiar with it. But these are abnormalities in children that a mother may not want her child to have. No mother wants her child to have it. So you want to know, is there a risk that this child will come out this way? So between 11 to 13 weeks is a window. Beyond that period, that assessment, the fluid behind the head does not signify the same thing. Now, apart from that, in this same period, there are major abnormalities that could have occurred that will be seen, not being predicted, but could be seen at that time, at that 11 to 13 weeks. Okay, there are children that at that age, they have what is called a acrania. Now, there are also abnormalities that cannot be found out at this time, this window, that would have to do a scan at a later date, which I'm going to discuss, to discover. So that is the nature of things. So this screening at 11 to 13 weeks is very important. Now, the next scan, the third scan in pregnancy, is usually scheduled at between 18 weeks to 22 weeks and is called the anomaly scan. Now, this anomaly scan is also known, some people call it 20-week scan, mid-pregnancy scan, anatomy scan, level 2 ultrasound. It is a routine prenatal ultrasound that evaluates the fetus, placenta, and maternal pelvic organs. It is a detailed scan of the baby. All right, we scan the baby from the brain, the spine, the eyes, the abdomen, the intestines. Now, the idea is to detect congenital defects. Some of the things that you could not have seen at the 11 to 13 week scan, we may be able to see at this 18 to 22 weeks scan. Um, this is also the time that you could check for the baby's gender, and with high, it's clearer to see at this time. This is actually the best time to evaluate for the sex of the baby. Right. Now, the quality of the scan image can also be affected by factors such as the mother's size and the baby's position. So some things may or may not be seen. But the truth is that this is an opportunity to thoroughly evaluate the baby's organs. So far I've discussed the 6 week scan, 11 to 13 week scan, and this is the anomaly scan at 18 to 22 weeks. The next scan I want to talk about should be done at 36 weeks. Some places is done between 34 to 36 weeks of pregnancy. Now, this is where the child's growth is being monitored, the child's well-being is being monitored, and the obstetrician, the matron, the care provider wants to decide how this baby will be delivered. So the questions he wants to answer include: how is the baby coming? Is the baby coming with the head? Is it coming with the bum bum breech? Is the baby lying transverse? Or is it the placenta? Is it the cord presenting? Is there a placenta previa? What grade of previa is it if it's there? Okay, what is the baby's weight? Now, even if the baby is coming with the head, if it's coming kefali, it's coming with the head, is it coming with the back of the head front or is it coming with face? These things have implications as to how the baby would be delivered. How much amniotic fluid is there? What is the placenta location? How is the biophysical profile? At 36 weeks, the ultrasound answers some of these questions. And this enables the estimation, enables the ultrasonographer, the sonologists, the care providers to be able to pick out high risks, to pick out pregnancies at risks of complicated births. This is important because it enables the delivery to be planned in a way to obtain the best outcomes. Now, um, to summarize, for safe care in pregnancy, for the best outcomes in pregnancy, we advise that there should be 4 routine scans in pregnancy. The first should be at 5 to 6 weeks gestational age. The second scan should be done between 11 to 13 weeks gestational age. That's the knockout translucency scan. Now, the third scan, the anomaly scan, should be done between 18 to 22 weeks gestational age. Now, the fourth scan, in preparation for delivery to pick out pregnancies at high risk of complicated births, should be done at 36 weeks. Now, let me emphasize, a woman may be asked to to scan more frequently if, for instance, she has a complaint or there is something that concerns the doctor in her history or in her scans or lab results. But routine, in the absence of complaints, these 4 scans are what we recommend, and they are for the safe care of these pregnancies. Thank you very much.